Hey, it's Ed. I just wanted to put this video on the channel. I have recorded the commercial that I did for the Qutenza patch. I did a video vlog on it. If you want to check that out, it's on my channel. It is a capsation patch that they put on your feet in your doctor's office. Mine was a pain management doctor, for an hour, and then they take it off, and then you're good to go. Well, one of the side effects is extreme burning in the application area, which happened to me. Typically it happens to about 60% of the people that do this procedure, and unfortunately I was one of the people that was in that 60%. But it did help me for about a month or two. They say that it's supposed to help you for up to 6 months, but I haven't gone back in to do a second treatment because my doctor's office messed up on the ordering of the first set of patches, basically because they didn't get a pre-authorization from my insurance. So the doctors in the practice decided to go ahead and to forgive me of that bill and not send me a bill of it, which I was greatly appreciative about that. But like I said, if you could please like this video, share this video, and subscribe to my channel, making sure you hit the active bell icon. I greatly appreciate it. So enjoy watching this video.
Peripheral neuropathy, also known as diabetic nerve pain.
It's a consequence for the 35 million people living with diabetes in the United States.
We're going to learn more about this debilitating disease from Dr. Neil Mehta. But first, let's meet Ed, one of the 5 million people in the United States living with this condition. Take a look.
The diabetic nerve pain that I experience started at my feet as like an overdoing tingling pain. Eventually that turned into I was walking on fire, and then eventually I was walking on glass. I feel that pain 24/7.
The Balancing Act met with Dr. Neil Mehta, Division Chief of Weill Cornell Pain Management, for more.
Painful diabetic peripheral neuropathy of the feet, or diabetic nerve pain, is a type of nerve damage that is a common complication of diabetes. Patients that are most at risk of developing diabetic nerve pain generally surround their control of their diabetes. But unfortunately, those that have good control still could be at risk for some sort of diabetic nerve pain developing over time. The symptoms of diabetic nerve pain can be numbness, tingling, painful sensations in both the feet and the legs. Complications can include chronic pain, falls, ulcerations, infections, and potentially leading to amputations. Diabetic nerve pain can impact their day-to-day ability to care for themselves, engage with their loved ones, and be productive at work.
A previous back injury led to an addiction to prescription pain medication, making Ed's management of his diabetic nerve pain years later a challenge.
Managing the pain has been a real battle with my doctors. It was really my mom that was my patient advocate, and she greatly spoke up when we were in these appointments to get the doctor's attention and to let the doctor know about the pain that I experience.
So when we meet the patient for the first time, we talk about what is the pain that they're experiencing. Patients with diabetic nerve pain often find it difficult to describe their pain. We start with scales, 0 to 10, but also it's important to use a framework to further describe what you're experiencing. How does it impact your ability to stand, to walk, complete your household tasks, going to work when it's time for bed? How well do you sleep? And then we'll dive into their pain treatments. Which medications have they been on? Did they experience pain relief? Did they experience side effects? What have they discontinued and what are they actively on? We'll look at their diagnosis of diabetes. How long have they had it and how has it been controlled over time? Furthermore, our physical exam looks at the overall condition of the legs and the feet. We'll look for presence or absence of sensation. We may involve neurologists who perform a test called electromyography, or EMG for short.
Nerve damage from diabetes cannot be reversed. This is because the body cannot naturally repair nerve tissues that have been damaged. Therefore, the focus is on preventing the progression with glucose control and diet and exercise modifications, as well as treatments to reduce the pain.
There are 3 FDA-approved oral medications prescribed for the treatment of diabetic nerve pain of the feet. They are pregabalin, duloxetine, and tapentadol. These are systemic and affect the entire body. There is one FDA-approved topical prescription treatment called Qutenza. Qutenza capsaicin 8% topical system works differently and is a patch that is indicated to treat diabetic nerve pain of the feet. Qutenza is applied for 30 minutes at the doctor's office and has been shown to reduce diabetic nerve pain of the feet for up to 3 months, and it can be used with or without other pain medications.
Qutenza is indicated for adults with neuropathic pain associated with diabetic peripheral neuropathy, DPN of the feet. Qutenza can only be applied by your healthcare provider. Qutenza can cause severe irritation of the eyes, mucous membranes, respiratory tract, and skin. Patients may experience pain and burning upon application and following removal of Qutenza. Reduced sensation in the feet may occur. The most common side effects were redness, pain, or itching where Qutenza was applied. If any of these side effects become severe, tell your doctor immediately. Talk to your doctor about how Qutenza may help reduce pain in your feet.
Systemic therapies can affect the whole body, as opposed to topical treatments that can be targeted and affect the areas that they're applied to. Systemic medications can be difficult to tolerate due to the side effects. Some topical treatments can provide pain relief, with the most common side effects occurring at the site of the application. An ideal treatment would provide pain relief while minimizing the side effects, including drowsiness, constipation, sedation, dizziness, or potentially risk of addiction to opioids. Opioids had previously been commonly used for pain treatment, but we know, due to the opioid crisis, that opioids need to be sparingly used. Consequences of using opioids long-term can be potential for risk of addiction.
I take pregabalin 4 times a day, and it helps doing the chores that we need to do for the day. Typically when we come back from town, I need to lay down and rest from getting up and walking all over. It's extremely hard to go to sleep at nighttime because I still experience that pain. None of the pain medications that I've been on have really been able to help control the pain that I feel in my feet. I really wish that there were more options to help control diabetic nerve pain that don't have any of the negative side effects like narcotics have. They really make you feel groggy, you sleep a lot. One of the really bad side effects that I've experienced is addiction, taking more pain pills that I'm supposed to take. And I was addicted for 15, 16 years of experiencing this pain.
Did you know there is a government-funded education grant that could deposit up to $38,970 directly into your bank account? That's right. Anyone who is unemployed or currently makes less than $80,000 a year may qualify. If you're tired of living paycheck to paycheck and can't afford to go back to school to further your career or earn your degree, then this is your chance. This money can be used for all expenses accrued while you're enrolled in classes. This can include childcare costs, housing, groceries, gas, and more. The best part is this money does not need to be paid back. Don't miss out on this opportunity that millions of Americans are already taking advantage of. To see what you qualify to receive, just complete a simple 1-minute form. To get started, click the link below now. On the next page, answer a few questions and you'll be done in no time. Don't miss out on this program. Click the link and get started today.
buy with $1.
Bitcoin!
All your favorite cryptocurrencies.
The Foundation for Peripheral Neuropathy advised Veritas Pharma in the development of a patient-focused survey to help generate disease education. Findings included 90% of patients have had to make significant lifestyle changes due to their diabetic nerve foot pain, and 58% are not satisfied with their current treatment plan. Furthermore, better treatments and freedom from pain were the overriding perspective shared by patients with diabetic nerve foot pain when thinking about the future.
In order to have successful treatment, it's important to have an open
it's
dialogue with your doctor.
I just wanted
As
to
a physician,
thank you
it's
for
important
watching
for
this
me to
video.
understand
If you could
what we
please
need to
like
focus
the
on.
video,
Is the treatment
share
worse
this
than
video, and
the
subscribe
disease
to
to
my
begin
channel,
with?
making sure that you
Is
hit
there
the active bell
limitations or
icon
side effects
so
that are
you can be
causing
notified when
you
I
trouble?
put out a new video.
And should we think about
Thanks.
alternatives?
But I do
Especially
want to
new
say,
things that are coming to
basically
market.
a warning
When I found out that
for,
there wasn't
using,
a pain management
using
support
this
group
treatment.
here
But
in my
I do have
local
to point
area,
out one thing.
I really felt the
is
need
that
to go ahead and
probably
start
about
one.
60% of the
And
people
we are actually
that
affiliated
tried this patch,
with the ACPA,
experienced,
American Chronic Pain
extreme,
Association. I want to take my
pain
pills
on their
correctly
feet,
because I don't
basically
want to
because
be
the
a
patch
disappointment
is made out of
to the
capsaicin,
people in
which
in
is
the
an
support
extremely
group that I've started.
hot medicine.
My advice to patients
And
is to
basically
speak
what
with
they
your
do is
physician
they
about the
put,
symptoms you're experiencing, both with your condition and the treatments that you're
wrap
undergoing,
a patch
and any side
around
effects you
your
may be
feet,
experiencing.
and then
Patients
leave
may
it
not
on
be
there
aware that a
for
pain management specialist is
about
an
an
option
hour,
for them. And most
then they come
importantly,
back in and take it
educate
off.
and empower yourself
Unfortunately,
to learn
I was
about
one
what's
of
out
the
there for you.
60% of
We are in an
people
exciting
that,
time
experience extreme
for
pain.
medical treatment,
And
and
after
there's
speaking
so
to the
much
company
innovation
about
in this
that,
space.
it was determined
For
that
full
my
prescribing
doctor,
information, visit
who did the
qutenza.com/PDPN, and you can see their ad in
I figured that
Kiplinger
out
Personal
when my doctor
Finance.
came
You can
in
always
and
visit
said
our
that,
website,
he had never
thebalancingend.com.
heard of the Qutenza patch, and that he just watched a YouTube video on how to administer the patches, which I really wish there was a specific YouTube program made for doctors so that they could go into a little bit more of a deeper explanation about how to apply the patch. I would probably bet to guess that the 60% of people that experience negative side effect were from doctors that did not know how to properly administrate it. So, bye now. Have a great one.